I think the two really cool products they have, one is where they take artificial intelligence and natural language programming and processing, and they pull out information from the electronic medical record, so it can go find disparate elements, even in the medical note, and they can align it with the criteria in a clinical guideline. They can say, we found these 6 of 7 things you need, or 5 of 12, and they can pre-populate that. And then the doctor or the nurse, whoever's making it, can say, oh, this patient fits these criteria. I didn't have to go dig it out. I didn't have to go hunt for it. And I now know the best course of action for this individual based on the MCG guidelines has been prepackaged for me and pre-digested. That's really cool accelerant of clinical care. If you're in the busy ER and you're trying to figure out what to do, and you got to page through a bunch of EMR kind of records, and then you got to, oh, here's the lab value, here's this. Like, that takes forever. And then you got to look up the criteria. Like, if you can just collapse that all into one succinct digest, like, that's incredible, right? You've gone from like 20 minutes of work to like 2 minutes. And then you can spend more time with the patient, right? Taking care of them. And so the more we can get the noise of the EMR and the cumbersomeness there, collapse it and deliver it to the clinician, the more they have time with the patient. So that's really cool. And the other one is case managers running around the hospital historically have done case management sort of alphabetically or by room number or by floor or whatever it is. And now we can pre-digest the record and guide them and say, these are the patients that are most important to case manage now for a variety of clinical decisions. These can probably wait till later in your day, or these we already know are going to be meeting the criteria, so you probably don't even need to see them. The answer's already been sorted out. So all of a sudden their day is much more efficient, and it's prioritized to the more complex patients, which is more interesting, and I think makes them more effective again. So back to the, being more efficient. So those are really two really cool applications. So a lot of those capabilities then feed the authorization. So if you can prepackage data and line up with guidelines, then you can send that in a transaction to a health plan and say, hey, they met every criteria you want. Why do we have to fax? Why do we have to have a phone call just to prove it automatically, right? So this is all becomes kind of a kind of the auto authorization becomes a logical consequence of some of these other things we're doing.